Right now at 5, President Trump has declared a national emergency to free up more resources as the federal and state government try to get a better handle on the coronavirus outbreak.
And the declaration could free up $50 billion to help fight the pandemic. Money states and local counties need to respond to control the spread of the virus.
Right now, businesses, attractions, government offices, schools across Georgia are preparing to close for several days. We have a list running at the bottom of your screen. We keep getting updated information, so we'll keep updating the list that you see there on the screen. While the response is getting stronger, we are not seeing a dramatic increase in the number of confirmed cases in Georgia as of yet, anyway. We know they're going to continue testing, and those numbers could still change. We have team coverage for you tonight to give you the facts, keep you informed. We're going to start with Joe Hankey. Joe, we could see more cases starting next week as Georgia's able to conduct more tests. But the governor is urging everybody, as the numbers change, to not panic.
Cheryl, that continues to be the message. The Georgia Department of Public Health now releasing more details about confirmed cases of COVID-19, including people's ages. But there is information we have requested that the state has yet to release, which could let us better understand the scope of COVID-19 in Georgia. 42 confirmed COVID-19 cases and 1 death are the latest totals from the Georgia Department of Public Health. The state's numbers, though, no longer specify how many cases are so-called presumed positives, meaning their test results still need CDC confirmation. Data from the state does show the counties with the most cases are Fulton and Cobb with 8 each and Fayette and DeKalb with 5 each. Statewide, nearly half of all patients are between the age of 18 and 59, and only 1 child has been diagnosed. Around 2/3 of positive cases are males. Previous state numbers showed 2 confirmed cases in Floyd County, but now without explanation, state numbers only show 1 case in Floyd. In a press conference Thursday, Georgia Public Health Commissioner Dr. Kathleen Toomey said with limited testing right now, people who are high risk are being given priority over low risk people.
Current statistics look a little skewed, and that's because we're testing the highest risk patients, usually hospitalized, usually those with chronic health conditions.
But with the state receiving additional testing equipment as early as Monday, Toomey believes testing could soon expand.
Additional staff are being trained to increase our testing capacity. We currently can do about 50 tests a day. We hope by as early as next week, at the end of next week, we will be able to do up to 100 tests a day.
And she added more labs could soon begin testing in Georgia.
There are now commercial laboratories that are working in our state, including LabCorp, and I suspect others will come in because there is a market for COVID-19 coronavirus testing.
To get a better picture of cases in Georgia, we have asked the Department of Public Health how many people in total have been tested in Georgia, along with how many tests have come back negative, how many people who tested positive have now recovered, and how many are still hospitalized. So far, those are the numbers that we have not received. Cheryl?